Hello everyone! Today, Nexus People has the privilege to share a few minutes with the Viatris Portugal country manager, Alberto Navia-Osorio. Hello Alberto! Could you sum up for us your extensive and successful professional career?
Well, the first thing that you might know is that I have a degree in pharmacy. In fact, I have pharmacy genes in my DNA, as most of my family is linked to pharmacy and to the healthcare. From a more professional perspective, I studied pharmacy in Barcelona. I have a PhD in biotechnology and an MBA master. I joined Pfizer in 2000 as a sales rep. And from then I was in different positions as first primary care, then specialty care. Then I moved to the area manager role, and from there I moved also to more marketing and key account manager roles, mainly in Spain. And it was in 2014 when I moved to Italy as a director of business operations. And I spent there almost 1 year. Then I came back to Spain and I got a position as a commercial lead, first for inflammation, then for cardiovascular, and then from that I moved to the chief of staff for the developed markets in Pfizer. This means this was an amazing opportunity for me, working with over 50 countries across the globe, learning a lot about how different markets were approaching similar situations in terms of access, communication, promotion. Then I came back to Spain in 2018 when I joined Upjohn as general manager for Spain, and I was there for almost 2 years, since November 2020, when I got this position, the current one, as country manager for Viatris Portugal.
As you have explained, in 2021 you took up the challenge to become the country manager of Viatris Portugal. Which were the main challenges you faced after working for Pfizer for 2 decades? How do you expect the Portuguese society to perceive Viatris under your leadership?
Viatris is one of the largest pharma companies in Portugal. We are leading the pharmacy retail market. Viatris has a wide range of products. We have innovative brands, mature brands, generics, biosimilars, and OTCs. Here in Portugal, we are an organization of over 200 people. Amazing organization, vibrant, talented colleagues, engaged environment, and very focused on do our best every day. Moving to Viatris was an excellent opportunity for me. Of course, because I love to work with a very wide portfolio. I love to know a different country, different market, different environment, meeting with a different team, and that was fantastic and a great opportunity that I don't spend a second to say yes to join this. But beyond that, I confess that I'm also embracing Viatris' mission, that it's empowering people worldwide to live healthier at every stage of life. My understanding is that currently the healthcare environment is very challenging because governments are trying to do their best to maintain the best possible levels of health outcomes. However, they are facing significant limitations or significant issues. For instance, the aging of the population, the incremental costs, the limited budgets. So the authorities need a trustful and reliable partner to work with them to provide the best possible solutions to the population. And this is what exactly Viatris is able to do. Thanks to our capabilities, to our portfolio, to our experience, to our talent, to our commitment, we are able to provide solutions for the largest part of the population. For instance, for hypertension. But at the same time, we are also able to deliver medicines that have rarely one patient, for instance, for tuberculosis antibiotic resistant here in Portugal. And then as part of my transition to Viatris, I committed myself to bring to Portugal fresh mind, very wide open eyes, because for me Viatris needs to be or should be a different big pharma. Why? Because our people and our value proposition and our go-to-market model is completely disruptive. So we need to find ways to communicate in a different way and to engage with people in a more engaging and different way. This was one of the main issues that we faced, and really very proud of what we are achieving at this level. Also from the respect and understanding of the market and the society and the patients is where, together with my leadership team, we are building a very efficient and committed organization here in Portugal, that is able to deliver different solutions for different patients in different environments at every stage of life. This is something that we are doing very, very successfully, and I am very proud of it. Leading also means that you have more responsibilities, even beyond the pharma environment. So that's why, from the very beginning, we are very committed with the corporate social responsibility. We are also engaging and supporting the Sustainable Development Goals. And we are working with different NGOs here in Portugal, somehow to lead the way and to show the impact that Viatris can have in the pharma environment, but also enlarge our impact and get people around in Europe to live healthier and to live better.
The pharmaceutical sector is very present in society through the media, especially since the beginning of the COVID-19 pandemic, from which we are still recovering. In your expert opinion, do you think that the health system managed this health crisis efficiently? What are the lessons learned?
I believe that authorities and the health system in general has managed the situation effectively. Of course, there has been ups and downs, and the healthcare system has been evolving. If I see from the pharma sector perspective, it has been very challenging, and we have been doing our best to adapt to this uncertainty situation and to this rapid changes environment. I would also say that perhaps something that we need to keep recognizing is all the efforts and all the hard work that have been delivered by all the healthcare employees. My impression is that perhaps a lot of pressure has been put on them in a very uncertainty environment. One of the main lessons that I take from the lockdown, from this COVID environment, is that the collaboration between stakeholders is crucial. It's crucial because it allows you to communicate better, to understand the different points of view, and find more common ways and bring all the talent and all the different ideas to fix the situation and to find the best solution. Because it has no sense to keep blaming or to keep complaining. We are here and we need to find solutions that work for everyone. In terms of takeaways, I would say that the coordination among global, regional, and local agencies is crucial, and also the different stakeholders, and it's important that we keep this collaboration and this communication ongoing to be prepared for upcoming crises that might happen. I also think that a transparent, frequent, and trustful education and communication to society is very important. We need to increase the awareness of the society regarding healthcare issues, and how important is the individual behavior of everyone. When we are facing these situations like this. I would also say that the collaboration among public and private companies is critically important. We cannot rely only that authorities will take care of everything, because the resources are limited, and we need to work together to find a solution, and everybody might help. I think that it's also important that healthcare providers keep investing in training and supporting the development of our healthcare professionals to be prepared to crisis situations, but also to increase efficiency or to work in different environments. I think that also the continuous training is very important. Another important learning is that we need robust supply networks. We are still feeling the consequences of the pandemic and the lockdown and the delays that happened at different levels. So my recommendation is try to reinforce or to facilitate that we have at least a dual source for most of the products that we need, that we consider critical. Ideally, inshore and outshore, just to diversify and minimize the risk. And another important takeaway for me is that we need to build flexible infrastructures, that can accommodate different needs. At that, in the case that it's a pandemic like COVID, you can use these resources, this infrastructure in a way. But if the problem is a different one, you can easily move these resources to face the different issue. And then, from a more general perspective, I would strongly recommend that we all get more familiar about use of digital tools, and especially take care of the environment and the diversity. It's very important that we keep taking care of our planet.
For the past few years, multinational pharmaceutical companies have been forced to adopt a fast-paced digital transformation to keep up their compromises with patients, creating new channels of digital communication. On this area, what do you believe are the main opportunities technology offers to pharmaceutical companies? Is the speed to which the patient has access to innovative medication still a pending subject for the health system?
My understanding is that the pharma sector is under a technological transformation. First, because we need to meet patients' evolving needs across the world. Also, we need to meet authorities' requests, but also society expectations. Healthcare systems are going through a digital transformation to deliver a better patient experience, to improve the healthcare outcomes, and optimize the limited resources, as I was mentioning before. The pandemic has accelerated the acceptance of the digital channels. I think it's very important to develop internal capabilities in these areas, as the trend is that patients and physicians will keep interacting with the pharma companies, perhaps in a higher level, but mainly through digital. Creating and nurturing a digital mindset is very important I would say that for all the pharma companies, but especially for Viatris. My view is that we should think digital first, and then for some specific develop physical or analogical content. But for sure, we need to have this digital mindset, as Gen Z is showing us. From a Viatris Portugal perspective, as we are such a large company with so many products in different segments, we understand that we need to be very focused on patients and to be present in most of the channels, to accommodate our patients' expectations, but also the health authorities' requests, and also the prescribers' researches. I would say that we maintain a quite robust traditional approach, as websites, webinar, rep-trigger emails, centralized email blasts, or remote detailing for physicians and pharmacies. But at the same time, on top of this, we keep evolving and bringing new channels. For instance, the MMS, or developing podcasts and videocasts. In our digital transformation journey, now we are more focused on delivering an optimal customer experience, offering the best channel mix for everyone. For me, this is the secret ingredient, to find the right mix for every single patient or prescriber or citizen that is looking for information in the digital environment. I would also like to add two more reflections from my side. First is that we are talking about digital, but don't forget that people are very, very important, and we still appreciate interacting with other humans, So it's important that we maintain the face-to-face interactions with customers and stakeholders, and we ensure that that there is always a person overseeing our communication, Digital is important, but people are even more important. The second takeaway, I would say that it's critical to have a strong data-driven system, because when we are planning and we are in this learning environment and this experiencing, we need to be aware that we might fail, or that we can get something wrong, or that we can take decisions that perhaps are not the most appropriate. So if we are working with a high-quality partner that has access to very good and quality data and has the knowledge, for sure that the success chances are higher.
Is the speed of delivery of innovative medicines one of the pending subjects of the healthcare system?
My opinion is that the best way to achieve this is to have the right balance and rely on public and private collaboration. In Europe, the process to get approval and reimbursement is far from being uniform, as it can vary from a few days to several years. Europe is changing, and we will have a centralized assessment model. This means that the negotiation will still remain local, but the assessment will start while EMA is still assessing the documentation for approval, and this can mean a significant improvement in terms of timing. Also, the PRIME scheme launched by the EMA supports the development of innovative medicines that target an unmet medical need. I think that it's also very good. I would say that vaccines against COVID were a new challenge, and it showed that a close collaboration, dialogue, and risk sharing can work well for all the stakeholders.
To conclude, Alberto, we come back to the so-called digital transformation, to which companies have been pushed to invest in technical means and to improve their omnichannel communication. Which are the communication channels open between Viatris and the patients? How do technological partners like Nexus People act to strengthen these channels that work both ways, from Viatris to the patients and from the patients to Viatris?
My experience is that pharma companies are investing significantly in technical resources for the digital transformation. The communication between pharma companies and patients is highly regulated and limited, especially in the pharma prescription sector. So in most of the European countries, it's not expected that you as pharma company are providing information about a specific product to the population and not even to the patients. This content is to be shared among healthcare professionals. And then regarding the communication, the pharma sector in general has already developed very good platforms, channels and content to provide the highest quality information and training to professionals, and are also using virtual channels to interact and support the prescribers. When I look back, I realize that the pharma sector has been improving and delivering and more channels and better content along the years. starting with a company or brand website, at the beginning of 2000, Later we improved the interaction with HCPs through emails or blasts emails or remote detailing. Then we moved to the chatbots, and then during the pandemic, I feel that there has been an explosion of webinars, SMS, and WhatsApps. Now, my understanding is that Viatris is leading the way in digital in Portugal, since we have our studio in-house, fully equipped and run by Viatris employees. So we have the ability to prepare our own content for different channels, from webinars to RTEs or podcasts, videocasts or MMS. When we are planning the content in Viatris, we are very sensitive to listen and support customers with their needs, because our understanding is that this is the best way to be customer-centric and patient-centric. In this way, we are sure that we are preparing meaningful content, meaningful material, and using the best channel, because not all the content, not all the, as I said before, not all the stakeholders like the same channel mix. In Viatris, we also dedicate significant amount of time and resources to know better our customers and to identify the best channel mix for them. Because we are aware that in this omni-channel universe, the offer is growing, is very, very, very high, and it's important that we have a good position, a meaningful approach to our customers, and that they rely on us. Nexus People value proposition is very meaningful, since you are bringing your resources, your experience, and your expertise to support the pharma companies in this long journey. We are aware that in such a dynamic environment, awareness, adaptation, and creativity are critical to deliver meaningful and high-quality content. In the interactions I maintain with Nexus People, I always have seen that you have a highly professional team, very committed to deliver. Nexus People offers to us trust advice, support to choose the best channel mix, and to provide professional support to ensure that we keep meeting our expectations and improving our performance.
Thank you, Alberto, for being here today and for answering to our questions. And thank you all for listening to this interview. We hope you found it interesting, and we hope to see you soon. Bye.